Good afternoon and welcome everyone to today's webcast entitled Heavy Caseload Management and Quality Documentation. I am Xinsheng Cindy Kai from the American Institute for Research, or AIR, who led the development of the webcast. Today's webcast is part one of the two-part webcast series on effective caseload management. Our presenter is Dr. Cristina de la Hunt Espiaga, who will discuss strategies for managing heavy caseloads and describe effective methods for documenting caseloads. These principles of caseload management can be applied with VR clients across the continuum of care in public VR agencies, rehabilitation facilities, and in private settings. The webcast is offered through the Center on Knowledge Translation for Disability and Rehabilitation Research, or KTDRR, funded by the National Institute on Disability, Independent Living, and Rehabilitation Research, or NIDLR. I want to thank Rebecca Gaines from AIR, who was instrumental in developing today's webcast. We have information that accompanies today's webcast on our website. This includes a PowerPoint file and a text description of the training materials. So please remember that these materials are copyrighted and you must contact our presenter to ask permission to use any of the information. Now, I'd like to introduce our presenter today. Dr. Cristina de la Hunt Espiaga is an assistant professor in the Department of Child and Family Studies, Rehabilitation and Mental Health Counseling Program in the College of Behavioral and Community Sciences at the University of South Florida, Tampa. Tina is a former state director of Family Programs and Services for Brain Injury Association of Florida. She's also a certified rehabilitation counselor. Now I'm going to turn to Tina, who will begin her presentation.
Good afternoon, everyone. Thank you very much, Cindy, for the wonderful introduction. I'd like to take a moment to thank the Center on Knowledge Translation for Disability and Rehabilitation Research. Thank you for the opportunity to present, and also thank you for your support in developing this wonderful presentation. My goal for today is to provide you with an overview of caseload management, quality documentation, and evidence-based practices in case management. So this will be divided in three sections today. Prior to beginning, I would like to note that we are going to talk a little bit about the WIOA, or the Workforce Innovation and Opportunity Act, that was passed into law on July 22nd, 2014. For those of you that are not familiar, WIOA is designed to help job seekers access employment, education, training, and support services to succeed in the labor market and to match employers with skilled workers they need to compete in the global economy. Part of the WIOA, again, this will be covered in more depth in later presentations presented by Dr. Jorgensen-Smith. As an intro to today's presentation, the WIOA it incorporates the AJC system, or improves the American Job Center system. WIOA increases the quality and accessibility of services that job seekers and employers receive at their local AJCs. States and local areas are encouraged to improve customer service and program management by integrating intake, case management, and reporting systems. So as you can see, the presentation today does align with the WIOA. So before we begin, this is just a general question for everyone on the line today, for you to think about actual tasks associated with case management. So which of the following tasks are associated with case management? Intake interviewing, service coordination, case recording, case reporting, or all of the above? So the answer is all of the above. Now we're going to provide a general definition of caseload management. According to the CRCC Scope of Practice Statement, case management is a systematic process merging counseling and managerial concepts and skills through the application of techniques derived from intuitive and researched methods, thereby advancing efficient and effective decision-making for functional control of self, client, setting, and other relevant factors for anchoring a proactive practice. Case management has been described as a core and pervasive professional service that must be provided by all rehabilitation counselors. In case management, the counselor's role is focused on interviewing, counseling, planning rehabilitation programs, coordinating services, interacting with significant others, placing clients and following up with them, and finally, monitoring progress and solving problems. Additional job tasks. Oftentimes, vocational counselors have additional tasks which may include but are not limited to vocational assessment, vocational counseling, job placement and related counseling, job development, job accommodation and modification, referral to and collaboration with vendors, case documentation and report writing, oftentimes using computer software, and continuing education and training. What is effective case management? Rehabilitation counselors are constantly being encouraged to adopt and pursue evidence-based practices. I'm sure many of you have heard of that term throughout your day-to-day practice. Time is a limiting factor for all of us, especially for counselors, and is an important consideration. Time management principles are key along with knowledge of best practice models of vocational rehabilitation. And during this presentation, we'll take a few moments to discuss some best practice models within the VR system. So time management. Some helpful time management principles that may be helpful for rehabilitation counselors include creation of a system that works for you and adhering to the system. One system does not fit all, so it's going to be very important for you to create a system that really works for you. If coworkers happen to be doing a great job at work, ask them to talk to you and to discuss their system. Research has shown that professionals who plan daily are able to realize more important work goals and have to-do lists that help get things accomplished. Plus, it really feels good for all of us to cross things off our to-do list. You want to analyze how much time is required in each task. For example, your intake interview may take an hour to an hour and a half. Ask yourself and estimate if this time is realistic. You always want to make sure to allow for the unexpected. You might want to budget in 30 to 45 minutes a day for unexpected tasks and situations that may arise. You also want to assess the uncontrollable. So for example, if you have a client, which I'm sure many of you do, that calls multiple times a week, you want to remind them that you have other clients and you will not take their call again until their next scheduled appointment. It's also important to delegate and minimize the involvement of routine and repetitive tasks wherever possible, so try and break it up. This can include delegating scheduling tasks to clerical or technical staff when possible. And if you do this, please make sure to thank them for their time and for their work. Time management principles continued. Another thing that might help you would be to consolidate similar tasks. For example, you want to plan time ahead to answer emails. Consistent with selecting certain times to respond to email, individuals may consider turning off email alerts every time a new email arrives in your inbox due to the fact that it can be very distracting and can interrupt your workflow. You also want to actually take time once a week to schedule time just to clean out and clean up and organize your mailbox. When you're at work, use prime time for prime work. You also want to avoid procrastination and identify time wasters. And in the end, provide a healthy reward for yourself for reaching your goals and completing your tasks. It is likely that most everyone attending this call today uses some type of daily calendar or planner. This can include Outlook, a paper planner, both, or other reminder tools. The question I have for the group is, how many of you actually budget time for unexpected events? I'm assuming not all of us on the call. Many people, including myself, may overbook or overschedule, which could cause significant issues if unexpected tasks or events arise. It's important to encourage quiet catch-up time every day, like I stated prior, between 30 and 45 minutes. This time is devoted to catch up. It's a good time and a good idea to turn off your cell phones and your text alerts. Turn off the new email dings and alerts during this time. Some counselors state that listening to soft Baroque classical music or some background music of choice can kind of help them focus and concentrate. And if your policy permits at your place of work, close your door and place a note on your door stating, I am working on X, Y, and Z for 15, 30, 45 minutes, if you're allowed to do that. That can help with people coming into your office and knocking on your door and saying, I have just a question. Do you have just a minute? So you can actually focus and attend to your tasks. Finally, if possible, allow for 5 minutes of quiet meditation time per day. No music, cell phones, emails, or texts. So one example that we teach in the rehabilitation counseling program is we encourage our students that are new in the field, in their practicums and their internships, to learn how to reserve 5 minutes of time a day to close their door, to sit down and place their feet firmly on the ground if possible, and to close their eyes and to breathe in for one breath, hold, and then breathe out for a breath, and to repeat that up to 10 and then back down again to 1. Again, it only takes about 5 minutes, and we can all find 5 minutes a day to kind of have some quiet time. And what we find is that our students feel more grounded, they feel recharged, and likely have improved focus by just taking that 5 minutes. This also can work really well for you if you've just had a very challenging client in your office, or if you feel frazzled or frustrated or overwhelmed. And again, I think that in our busy workday, we can all budget 5 minutes of quiet time that I think will greatly improve our practice and management of caseload burnout, which is a good segue into burnout. So as many of us know, working in case management, it can be challenging at times. Stress can be a big factor that can impact our job and is part of our job. Stress-producing factors are inherent in case management and rehabilitation counselor jobs. Examples include the fact that we have extensive client contact, we have multiple and numerous caseload responsibilities. Sometimes, unfortunately, we have negative case outcomes. We experience and are exposed to a wide range of client emotions. And sometimes our cases may be open for a long time without full resolution. Oftentimes, we are faced with a quantity versus quality dilemma. Research has indicated that the larger the caseload, the more exhausted the counselor feels, and this may negatively impact their performance. So how do we reduce burnout? So these are a few suggestions. These are not all of the techniques out there for reducing burnout, but these are some of the most popular ones. So some approaches to reducing burnout include leaving the client and their case at the office. So for example, use the time commuting from work to home as a time of day to decompress and have closure for the day. So once you're in your garage or once you're home, no more client work, and just make that a rule. Also, try not to take things personally. Some clients will do very well, and some clients, no matter how hard and no matter how much time you spend with them, will not do as well. As long as you do your best in every situation, you will know you have done your best. You can also ask your supervisors for clarification of work roles and realistic goals. You can seek advice from supervisors or coworkers when appropriate. Another suggestion is to avoid office drama and gossip. You don't want to be the one that's known to be hanging out by the water cooler. Refuse to get involved and state that it does not help you perform your job. If the gossip and the drama does not help you do your job, avoid it if at all possible. And in fact, you'll probably be a lot happier as well. Finally, be positive and be grateful. Appreciation goes a long way. Be kind whenever possible. Remember, you never know what another person may be going through. And our clients may disclose, but not always. So keeping those things in mind can greatly help to reduce some of the burnout you may be experiencing. So this may be easier said than done, but learning how to handle stress more effectively. So there are some additional approaches. So this is probably not new to the folks on the phone, but maybe taking up yoga once a week, practicing breathing, warm baths, walking, etc., taking a 5-minute walk break, anything that works for you to help you handle your stress more effectively. I cannot overemphasize the importance of learning meditation techniques that work for you. You also want to use your vacation time for vacation, not to catch up on work. I think we all might be a little guilty of this. In terms of your office environment, you want to create a clean, calm environment. This can include changing your lighting and having lamps instead of fluorescent overhead lighting, freeing clutter from your desk and having an organized office will give you a clean space. If scented oils or a salt lamp are allowed, I suggest using them in your office. I know that there are some facilities where people have allergies and scented oils or a scented oil diffuser might not be a choice, but you could use a salt lamp as an alternative that would not affect those that are hypersensitive to fragrances. And you might also want to just come into the practice of having soft music playing in the background all day, stream through your computer if permitted at work. This is another big one, trying to eat lunch away from your computer screen. I know this is not possible all days, but on days that it is possible, do strongly encourage that. We spend a lot of time in front of our computers as we're doing right now, and I'm sure many of you on the line are doing some other things while you're listening to this webinar, but taking at least 10 to 15 minutes to have your lunch away from the computers is a great idea. You could go sit in your car, maybe outside on a bench. It's just good to have a little break from the computer, as well as taking stand-up breaks from your computer as well, permitting that you can do that. You also want to try and create diversions from the stressful aspects of the job that you can't change. For example, some clients may have progressive disabilities and you can't provide them services to improve the situation. And also you might have limited access to resources for clients due to budgetary constraints. So in the end, do the best that you can with the resources that are available to you at little or no cost and try and be creative, and also be honest and sincere with your clients about the realities of budget constraints. All right, so this is time for a review and a learning check. Planning, managing, and evaluating are keys to counselor success. Once plans are determined, consider allocation and management of time. Time management principles covered in this section can help increase your effectiveness and potentially and hopefully help reduce some burnout. We are going to talk in the next sections about quality documentation and evidence-based practices in voc rehab. Quality documentation. In this section, we're going to discuss case recording and case documentation. Case recording and case documentation are terms that are frequently used interchangeably. And my question for you, is it correct to use these terms interchangeably? The answer is no. They consist of distinctly different meanings and functions. Some organizations may actually have their own definition of case recording and documentation, so this may be a little different from your organization, but we are going to go through definitions of case recording and case documentation. So case recording includes individual counselor contributions to the case file folder development, and this can include factual information such as client work history, and it can also include subjective information such as clients' thoughts and beliefs about working, which we know are really key to determining if they're ready to go to work and their potential success in returning to work. Case documentation. Case documentation includes case file and folder contributions from the totality of resources that affect the client's rehabilitation efforts. Case recording becomes documentation material once it's added to the actual case folder and made part of the official record. Some of these examples can include workers' comp records, academic records, medical reports, VE reports, vocational reports, etc. The primary purpose of combined case recording and documentation is to bring together all pertinent data that facilitate the relationship of all individuals involved in the rehab process. Accurate and complete information supports provision of quality rehabilitation services. Client, counselor, and company. Case recording is used to facilitate the client-counselor relationship. Appropriate case recording and review facilitate counselor understanding of the client and contributes to sound management of the case. So in terms of adequate case management, adequate case recording should demonstrate counselor problem solving and successful counseling activities. So case recording and documentation are important for successful administration and also for supervision. Agencies are required to provide quality control, improve operations, and adhere to legislations, policies, and regulations. Justifications through case documentation may impact many things, including funding, provision of future services, and also measure outcomes. Common recording styles. Counsel flexibility helps improve skills in case recording, period. So some common styles of recording include recording on established forms, and I'm sure that forms can vary from agency to agency, but it seems like we all have a lot of forms we have to fill out for our clients when we work with them. We also include a summary of the recording, process of verbatim recording, research recording, and narrative recording. And I will go through what all of these are in the upcoming slides. Recording on established forms. Rehabilitation agencies have basic standards for case recording and often use a casework manual and standardized forms. So these can often include cover or face sheets, history intake forms, and also work history forms. Other types of recording include summary recording, which includes a condensed account of transaction between client, counselor, company, or agency. Process or verbatim recording includes a highly detailed account that covers actions, events, and reactions that occur during the interview. This is often useful for psychological evaluations or content analysis. Any direct client statement should be included in quotes if you do choose to include them in your file. Provide facts, not your opinion. That's really important. Remember, what you record is public record. Write your notes in a style that would be appropriate if posted on the front page of the newspaper or, the news blog. Recording for research purposes. Most cases are closed to research studies. If not, request copies of the IRB approval and the study purpose. Some studies may be approved in advance and may also be approved to gather new data and require completion of forms. Narrative recording. This is a condensed standard form of recording. This includes factual data and summarizes the client situation holistically. Elements of case recording. All recorded information must use accurate and reliable information. It should not include anything that's contradictory or confusing. It needs to be concise and consistent with client behavior and disability. It's important to include observations that state facts and not opinions. And also, it's very important to have anything written and included in the report be written using professional language. Case recording is not always an easy process. It requires that the counselor be personally and professionally secure. Further, counselors need to feel secure if their case records are reviewed. Approaches to case recording. Counselors must use a systematic stepwise approach when recording cases. The information recorded in the case file should be adequate to support a clear understanding of the client situation. Figure 1 shows a stepwise illustration of quality case recording. Steps will be described in upcoming slides. Step 1, record information immediately after the session. Your sessions may run together and oftentimes overlap, and you may forget important details. Step 2, you want to use a format or a guide to organize and record data. Once you become proficient, you will be able to save time. Step 3, make your decision and accept responsibility. Reasons for delays for case closure may be overlooked, even though counselors may have good intentions to make decisions for their clients. It's easy to defer situations when there are difficult dilemmas surrounding the case. So what you want to do is you want to document decisions accurately and precisely, and don't do it later. You want to do it today. Step 4, be able to differentiate objective versus subjective data. Avoid creating a distorted view of the situation. It can cause problems and can truly affect rehabilitation outcomes. Actions that are not based on accurate goal setting and decision making are also problematic. Step 5, record significant data. There's a fine balance between too little or too much documentation. Professional judgment is necessary for selection of data to be recorded. Information being recorded needs to support a complete understanding of the client. So you want to categorize, summarize, and condense this information using succinct labels and words that help clarify the data in your case. Then finally, you want to consult when necessary. I'm sure you have a wonderful network of colleagues that you have access to that can help you with consultation. It's really important to learn from others who have already developed those skills and expertise in case recording and documentation. You could even ask them to see de-identified samples of case notes and records to use as a guide. You can ask for feedback from supervisors and senior colleagues who are known for their excellent case recording skills. Case development and documentation. Case development is individualized, client-centered, and requires acquisition of appropriate data and records before it can be systematically managed. In Figure 2, you can see that there are 6 areas that include and influence rehabilitation efforts: medical, psychological, educational, situational, social, and vocational. Effective counselors, number 1, review previous case records and documents. Number 2, review input from other community resources. And number 3, have appropriate documentation before they actually take any action on any cases. Legal considerations. It's important for counselors to be aware of potential legal action. Adequate and reliable documentation free of subjective and false information is key to protecting the counselor. In Florida, it began its tradition of openness back in 1909 with the passage of Chapter 119 of the Florida Statutes, or the Public Records Law. This law provides that any records made or received by any public agency in the course of its official business are available for inspection unless specifically exempted by the Florida legislature. Over the years, the definition of what constitute public records has come to include not just traditional written documents such as papers, maps, and books, but it actually also includes tapes, photographs, film sound recordings, and records stored on computers. We are now moving on to our third section, evidence-based practices and case management. Evidence-based practices. Rehabilitation counselors and practitioners are encouraged to adopt and use evidence-based practices. As I mentioned in the beginning, we've probably heard this term a lot recently and frequently. The evidence-based practice model requires that counselors pose important and relevant questions based on sound research prior to making decisions and providing services to their clients. This can be a challenge at times due to research training, different practice environments, varying clients, and also varying clients' roles. Evidence-based practice. The effectiveness of VR counseling has been demonstrated, but there oftentimes is a lack of evidence-based practices that accurately define what interventions and VR services affect employment outcomes. Limited research are available on the types of services that might contribute to employment rates of disability and subpopulations. Determining the appropriate approaches for each client and client situation can oftentimes be challenging. In 2012, Fleming and colleagues conducted a literature review to examine 25 years of rehabilitation research focusing on active employment interventions, and also they looked at best practices. Service categories were based on their content reviews. Fleming and her research team reviewed 561 articles, and of these, 35 articles matched their selection criteria. These 35 were identified as active service best practices in state VR agencies. Through thematic analyzation, the following literature categories emerged: interagency collaboration, counselor education and consumer outcomes, services that were targeted to specific disability groups, and we'll talk about that a little bit more, supported employment and evidence-based practice, empowerment and customer self-concept, essential elements of service delivery, and finally, miscellaneous VR services and outcomes. So what were the results? In terms of interagency collaboration, on the practitioner level, interagency collaborations provide access to resources and services that might not otherwise be available. And this actually was the most common service category in the studies included in the literature review. Services to the target group. So what services are the most important to the target group? Services for specific populations are related to successful outcomes, not surprising. So for example, with the TBI population, one study found that adjustment and vocational counseling increased customer awareness of deficits, and tailored assessment, placement, and vocational guidance counseling affected employment outcomes. Supported employment. So there have been numerous studies that have researched supported employment approaches. For example, the IPS, or the Individual Placement and Support Model, is one that many of you are probably familiar with. Overall research suggests that supported employment and evidence-based practices for clients with severe disabilities lead to improved outcomes by providing a varying range of intense and individualized support services. Empowerment and self-concept. Studies have found positive relationships between employment, self-concept, consumer involvement, satisfaction, quality of life, and community reintegration and employment outcomes. VR services that include and address empowerment and self-concept may increase involvement, may increase service satisfaction, and ultimately improve employment outcomes. Essential elements of service delivery. Research indicates important information for service provision. Number one, it can make clients feel welcome and connected. And in the end, it's important to remember that it may take a lot for clients to even show up and to come into the office to ask for and to pursue services. Number two, target interventions. So this can include improving life and social skills as well as functioning. Number three, considering the way services are provided. So for example, teamwork oftentimes results in higher placement, customer service, and staff collaboration, and improved making connections. Finally, miscellaneous VR outcomes. There are a few of these in their study. We're just going to list the, just a few examples here. If you'd like to learn more, there's in the references we have a link to information on the full review synthesis of the empirical literature. Not surprising, they found that a better working alliance is equated with improved employment outcomes. In terms of assistive technology, counselors can benefit from additional training and ongoing training to keep up with emerging technologies. Family-focused services are also important. Research shows that including the family in planning can lead to better outcomes. Now, I know some of you on the phone might think that it might be a challenge to include some family members because some of them may be controlling or have their own opinions. But really looking at the social support system and looking at trying to incorporate natural and family supports in the rehabilitation planning process can really help lead to better outcomes because there's support and follow-through outside of the VR office. And finally, labor market surveys and labor market analysis. LMS or labor market surveys are useful tools and can help improve employment outcomes. And so this really should be done with all of your clients before you you send them out there to try and obtain and maintain jobs, because you really need to know what is happening in the labor market at the time you're trying to help your client return to work. So wrapping up, in summary, evidence-based practice is valued, and it's here to stay. So you as counselors and folks on the phone, it's important to take opportunities to stay up to date on evidence-based practices and research. What you can do is possibly ask for disability-specific trainings that you need and take advantage of those trainings that are available to you at little or no cost. Attending webinars is a great way to stay up to date, as well as in-person trainings. And if you can, and there's money and budget to send you to conferences, this is a great place to attend not only educational sessions in person, but be able to network with other professionals and colleagues who may have some information or some insight that you have not been exposed to. Being knowledgeable of effective VR service delivery practice can really help promote outcomes. The next 2 to 3 slides include a list of references that were used throughout this presentation. Again, this is not an exhaustive list of references for case management and quality documentation. However, it is a good list and a pretty comprehensive list of examples of references that may be helpful to you beyond this presentation. Finally, I'm going to go ahead and turn this back over to Cindy, and she's going to help us wrap up this presentation. I'd like to thank you for your time and for your attention today, and please feel free to contact me as well as contact KTDRR.
Wonderful. Thank you so much, Tina, for such an informative presentation with our audience today. And I'd like to remind everyone to fill out the brief evaluation form at the bottom of this slide. So we will email it to all who registered. This evaluation helps us to plan future events. Again, this webcast is part 1 of the 2-part webcast series on effective caseload management. We have developed a follow-up webcast on ethical issues and culture competencies surrounding caseload management. You may find more information about this upcoming webcast on our website at ktdrr.org. Once again, I want to thank Tina for her time in preparing this presentation and my colleague Rebecca Gaines for her support. I'd also like to thank the National Institute on Disability, Independent Living, and Rehabilitation Research for providing funding for this webcast. On this final note, I'd like to conclude the webcast, and we look forward to your participation in our next event. Thanks so much, everyone.